my patient, I chose to work with Mark. He recently had a checkup with his doctor where he received a lipid panel blood test that was used to find abnormalities like cholesterol levels and triglycerides. The results of his panel showed that he had high levels of a low density lipoprotein, or LDL, which a lot of people know it as the bad cholesterol. And he also had low levels of high density lipoprotein, or HDL, which is also known to most people as the good cholesterol. Now, these test results show that Mark is at a higher risk for cardiovascular disease as well as other health risks like a stroke due to his high LDL levels that promote fatty plaques in his arteries. Before conducting any form of intervention with Mark, it will be important to obtain a 24 or a 48-hour dietary recall to better understand his intake, along with his exercise and activity status. Looking at his stage of change, Mark falls in the preparation or the determination stage. And the reason for that is because he is preparing to take action to change his behaviors and his habits. He is acknowledging that where he stands in his current status can ultimately impact his health down the road. He wants and is ready to learn how he can make changes within his diet and nutritional status to aid in changing his lipid and cholesterol levels. He's already taken the first step by scheduling an appointment with a dietitian. So that just shows that he is in that preparation stage. Barriers to consider for Mark are of course going to be time. Does he have a set schedule? Does he have lack of time that prevents him from being able to go grocery shopping or prevents him from being able to do activities like exercise? Another barrier would be if he's feeling overwhelmed or whether he has that support system to encourage his behavior changes. Mark being in preparation stage, that rapport and that trust that's built between him and the nutritional professional is going to be vital because it is going to allow him to then push himself into that next stage, which is that action stage. Setting will be a tactic to use along with motivational interviewing to understand his current level of motivation and to have a better knowledge of his social, psychosocial, and environmental aspects that can affect his success in implementation of nutrition intervention. Implementing that nutritional intervention, nutrition education will play a big role in his success. This includes modifications for food and activity choices, but also further knowledge about the long-term impact his levels can have on his overall health. Another important factor of nutrition intervention would be through counseling and goal establishment with Mark. Recommendations would include increased activity to promote cardiovascular health, along with implementing foods that are high in soluble fiber, omega-3 fatty acids, along with decreasing foods with saturated fats. Items like whole grains, fish, fruits, and vegetables are great ways to improve his cardiovascular and cholesterol-related health. Now, the best way for nutrition monitoring would be through lab data and tests with regular blood panels to check his LDL and HDL levels. So essentially checking his cholesterol levels to make sure that we're monitoring it and making sure that they're going the other direction and not continuing in the path that he already started at. Another way to monitor Mark's nutrition intervention would also be through nutrition-related history outcomes by looking into his nutrition quality of life and tracking his physical activity. Hi Mark, how are you feeling since you received the results of your lipid panel that revealed high LDL levels and low HDL levels?
Honestly, I'm a little surprised and nervous for what is to come. I knew my diet wasn't the best, but I didn't realize how impactful it would be on my health. I want to make a change, but I have no idea where to begin.
Finding out results for your health can sometimes be difficult to hear, but it is important to know you are not alone in this process, and I'm here to help support you and give you the necessary resources for you to be successful. Now, are there any ways that you think that you could or would do to feel better?
Increase my exercise and activity. I have a desk job and I sit a lot, and I'm not very active throughout my work week. I used to run and ride my bike regularly, but I just hadn't have time. I could also change my diet. With my work schedule, I eat a lot, or I find something quick and easy to eat when I get home.
Having a busy schedule is often looked at as a hindrance, but there are ways to implement changes that will make it easier for you to be held accountable and maintain changes, like meal prepping and even implementing a way for you to exercise while working at your desk. What do you think would happen if you didn't make a change?
I know my high LDL levels put me at risk for cardiovascular disease and even a heart attack or a stroke. I don't want this to happen to me.
Absolutely, I completely understand where you're coming from, and I would feel the same way. Based on what could happen, how do you feel about changing your eating or exercise behaviors?
After hearing my results and the increased risk for a stroke or heart attack, I'm extremely ready to make a change and excited to learn ways I can change my lifestyle and reach a better nutritional and health status.
Awesome. I completely agree with you that this is taking that next step for you. How would you like your health to be different?
Well, I want to be more active and more knowledgeable when it comes to my nutrition so that I can live a long and healthy life. This includes exercising more and eating foods that are better for my health.
Absolutely. Now, what concerns do you have about eating healthier or exercising more?
I'm nervous about the time management and being able to stick to my changes. I think that on top of really not knowing that what I was doing was putting me at risk, I had a hard time just sticking to a specific routine.
Absolutely. And your nervousness is completely understandable, but I will be with you in planning and educating you on ways to be successful in getting you to your goal so that we can lower your LDL levels, increase your HDL levels, and decrease your risk for health concerns. Now that I know that your goal is to change your eating habits and exercise more, let's discuss the specifics of how you can make these changes. As I mentioned before, there are options to increase your activity while at work. Getting a stand-up desk will allow you to be able to implement a walking pad to be able to move while doing what you would normally be sedentary work at your desk. Implementing items like fish, oatmeal, fruits and vegetables, and whole grains into your diet will be helpful in increasing HDL levels, lowering your LDL levels, and decreasing triglycerides. The best way to have access to these items throughout your work week will be to meal prep. So the meals are readily available for you in your busy schedule and long work days. Does this sound like something that you'd want to do?
Oh, yes.
Awesome. Well, let's get started on those specifics.